Looking at the problem, looking at the situation that the world finds itself in, a couple of things are evident. It's not going to be the last pandemic that's ever going to hit us, but I would like to think that it's the last pandemic that stops the planet, that stops us all from doing what we're doing. My name is John Murphy. I'm the co-CEO of 8 West Consulting. We're a software development and consulting organisation based in Cork, developing solutions and products for customers around the world.
So the project I've been working on is CREW, and it's for staff of a hospital or for patients of a hospital to basically detect if they have symptoms of COVID-19 using different technologies.
So at one stage there was nearly 30% of the cases of COVID in Ireland were among our healthcare workers, and we essentially asked ourselves, look, what can we do to help?
We could come up with a system that could provide some reassurance for those staff. So we looked at the parameters of the disease, and certainly temperature spikes or fever spikes for symptomatic patients is one of the most common signatures. So I assembled a solution where I could use an off-the-shelf available wearable Bluetooth thermometer connected to a series of mobile handsets, then connected to a cloud monitoring system to be able to give early warnings, and not just a single temperature sensing like you get in a thermal imaging scanner, but monitoring it 24 hours a day.
So this is the actual sensor. I have one identical to this on right now. So it literally just sits under your armpit, and you stick it on every day, you charge it for every 24 hours for maybe an hour, and then you wear it for the next 24 hours. But no, it's very comfortable. I mean, I'm wearing one now all day today and you wouldn't even really notice that I had it on.
So with that then, to be able to determine if there's a temperature spike within that 24-hour period, and then you could essentially be looking to take potentially infected hospital staff, alerting them to the temperature spike and then keeping them outside of the hospital and keeping the infections outside of the hospital and stopping the hospitals from becoming overrun.
From the very outset of this project, we were looking to technical partners to help us crack the problem and to find the best way to deliver the right information to people. We found from the outset that Huawei were really, really helpful. They couldn't do enough for us. In fact, as soon as they heard about this project, they offered a lot of their Y6 phones to give to the hospital workers whose phones weren't compatible with our system.
Huawei Ireland were very kind in contributing devices for our use and trying them out in terms of proof of concept studies in the emergency room of Cork University Hospital. I'm in fact wearing one of the Huawei smartwatches now. I mean, it's a fantastic piece of kit, and it integrated very smoothly with the 8 West platform.
What the Huawei technology offers that others haven't is the watch itself has SpO2. Now SpO2 is your ability to take oxygen from the air.
You know, your staff have the peace of mind that they're being looked after and that their vitals are being constantly checked. It kind of gives everyone else a peace of mind too, that you know the people that you're working with, you know that their temperature and their details are being checked, so you know you're safe in your work environment.
So my favourite part of the partnership that we have with Huawei is simply how willing and how open and how enthusiastic and how ambitious they are for our partnership together.
It's a level of openness that we're getting with Huawei, and the level of cooperation is fantastic.
It's a global pandemic, so there has to be a global response. A global company like Huawei is perfectly positioned to help out in this. And when they come across, I suppose, opportunities from their perspective, like as this small Irish company, that's absolutely fantastic, and they were very much involved. But not only that, right? What Huawei have seen straight off is the future potential of this system.
There are lots of different sensors out there for use in healthcare, whether that's oxygen saturation sensors, whether it's blood pressure sensors. All of these can be integrated through the Huawei technologies. I'm convinced that we can create a platform that can integrate all of these different remote sensors, very much creating bespoke needs.
What I want to do with Huawei is to work on a vision of hospitals without walls. You know, what that could possibly mean for the society in general. Like it's a global problem that we're trying to solve. There are lots of organizations around the world who may be motivated in exactly the same way. When we work together in a partnership, then we're stronger than we are individually as individual companies. I think working with Huawei on a hospitals without walls concept is something that I'd really like to do.